The SCCA conference is a wonderful initiative that has been put together by the Princess Nikki Breast Cancer Foundation. And this is done in various African countries. This being the 9th, other countries have already hosted in conjunction with the First Ladies. In Kenya, we have our First Lady, Madam Margaret Kenyatta, who is hosting. And we're very happy about this initiative because it's bringing together all the elements that are required in cancer control.
Our gathering here is a sure sign that the future is bright for those who have in the past despaired, as only through collaboration can we find the solutions that we seek.
We have the awareness element, which is right now happening here with the free screening. We have awareness creation on mass media, so people are talking about it on mass media as well. Then we have the follow-on investigations for treatment, which is another continuum. But the conference itself is also bringing a lot of stakeholders from across the globe to be able to discuss cancer control and management in Africa.
We are aware of the government's capability to fund cancer. When fighting for resources, one is more likely to be allocated resources when awareness is increased.
The increase in cancer incidence will be greater in less developed regions than in more developed regions. And by 2030, it is expected that 60% of all new cancer cases and 70% of cancer-related deaths will occur in developing countries. Africa will be particularly affected because of late-stage presentation and the quality of treatment.
In Kenya, cancer is the third highest cause of morbidity, with an estimated 39,000 new cases each year. Clearly, the prevention and control of cancer is today a compelling priority, and the importance of this conference can therefore not be overemphasized.
Cancer does not have resources, so you must be committed for you to work in the cancer community. And we sincerely thank God and all our partners who have always supported this.
We should focus on stopping people from dying unnecessarily. The key to this, to saving lives, is prevention and early diagnosis. We must ensure communities are better informed about cancer, as well as the benefits of lifestyle changes. We will also need to vaccinate against hepatitis and human papilloma viruses, which cause infections that contribute disproportionately to the number of cancer incidences in Africa.
The 3 cancers for which we're talking about in this conference can be prevented, screened, and treated so that there will be less death. Because of that, the fight against cancer of cervical cancer, breast cancer, and prostate cancer is our priority in our government in Niger. We are very worried about the alarming data. That's why we have established a partnership with NGOs so that we can work together to eradicate this epidemic.
I came here to know my health status, and especially about breast cancer, cervix cancer. This service being provided to all counties would do many women good, because many women will not be able to travel here, but I'm sure many women would want to know about their status, knowing my health status. And I believe today I'm happier than I was before, because I am sure I don't have the breast cancer, I am sure I don't have the cervix cancer, and I know how to take care about my health.
Breast and prostate cancer are equally responsible for horrifying morbidity and mortality figures every year. Therefore, I must salute Princess Nikki, the First Ladies of Africa, the scientists and medical practitioners, and all of you here for initiating and joining the fight against these cancers.
congratulate Her Excellency Madam Roban Tesaye for being granted the rights to host the 10th SCCA next July. Your Excellency, you can be sure of our support, and we wish you the very best as you plan for the 10th anniversary of this very important forum.
We need to work hard alongside healthcare service providers to make sure that anyone who needs treatment can access healthcare, including the necessary medications for managing the illness of cancer. I would like to use this opportunity to call upon all the partners to join hands in prevention and control of cancer in low-resource settings. Excellencies, ladies and gentlemen, this conference is of great interest to us. I hope that our discussions here will inspire us in how to engage all crucial stakeholders to sustainably address the problem of cancer.
It is edifying to see a gathering of various stakeholders for the express purpose of sharing ideas, experiences, and expertise on cancer prevention and control. This is underscored by the theme of the conference, which highlights the necessity of multi-sectoral collaboration in healthcare service delivery.
It is my wish that we step up our communications by working closely with the media, civil society, communities. I urge you to use all available avenues to disseminate information about cancer so that we can have healthy populations and healthy nations.
The biggest takeaway that I took was that cancer is preventable and no one should die because of cancer, since there are mobile clinics where you can go for screening.
Wow, the conference was awesome. This was well organized. The First Lady, Margaret Kenyatta, she's fantastic. And we give her all the applause.
The conference has been very successful, and we look forward to going to the Ethiopian conference next year.